Health Conference. My name is Tuseko Sindano. I'm a water sanitation and hygiene specialist with UNICEF in Zambia. I'm currently here in the States and supporting with the conference coordination. So a huge welcome to you all, both to those joining online and everyone here in the room. I'm excited to be here, and now I'm very honored to invite to the stage the director of the Water Institute at UNC, Aaron Salzberg. Please join me in inviting him to the stage.
Thank you, Tuseko. And yes, I did broke my foot 2 days ago, so I will be hobbling around and not as fast, but at least all of you know it. We got that out of the way. But thank you, Tuseko, and thank you for all the hard work you've done to make this conference a reality. It's been a real struggle this year, and we appreciate that. There was a meta-analysis published in Frontiers in Psychology recently that found that people fear public speaking more than they do death. So I'm going to take a deep breath and one more time into the breach. Welcome everyone to the UNC Water and Health Conference, both all of you here in person and everybody online. It's a great pleasure, of course, to host you here in wonderful Chapel Hill, North Carolina. Usually this opening role is reserved for Kata Liang, and you'll often see her up here. She's the Director of Programs at the Water Institute and the Director of the Water and Health Conference. Rest assured, Kata is well, and she will be joining us in a few minutes, but virtually. You might ask why Kata would miss the conference that she's responsible for managing, and that she's poured her heart and soul into. Well, like many of you online, wait for it, she didn't get her visa. And so she will be joining us virtually. And so with a virtual Kata in tow, we will soldier on. Speaking of folks online, I do want to give a special shout out for those of you who are staying up late, those of you who've gotten up early to join us. You are as much a part of our discussions here today as everyone here in the room. And while you're not here in person, you are ever present in our conference, and we are very happy that you're taking the time to join us. I also want to welcome everyone who's traveled far to get to Chapel Hill, and I know many of you have. We know this wasn't easy for many of you, and just a reminder, especially for those folks online, apply for your visas early for next year. So that could be right on first on your list as soon as this conference is over. Apply for those visas. And to everyone who is with us today, I also want to acknowledge and send our thoughts to all of those who are coming or living in areas affected by conflict, all of our friends and colleagues across the Middle East, Sudan, Ethiopia, Myanmar, Ukraine, elsewhere. Our hearts go out to all of them, and again, those of you who've come from those areas have made a special effort to be here, and we appreciate that. We also extend our thoughts to those affected by the extreme weather events that we've seen across the world, Bangladesh, Nepal, India, and here in North Carolina and in Florida recently. So our hearts go out to all these communities that are struggling, and again, for those of you who still have taken the time to be here, we appreciate that. We often forget, but without human security, there is no water security. And so that comes at the core of everything that we do, and it's an important message from all these events that are going on around the world today. I also want to acknowledge the passing of a very close colleague of mine, Bill Cosgrove, last month. I don't know if any of you knew Bill, but there was no one who worked harder to make water and sanitation issues a global priority, and no greater champion for the underserved and the vulnerable. He was a great mentor to me, and while we will all miss him dearly, many of us are standing on his shoulders, and we're very grateful for having the opportunity to know him. And we've lost several folks in our community, but it's always good to acknowledge some of those names and remind all of us where we came from. Okay, so this year is our largest conference ever. We had over 1,000 people register. We received nearly 700 abstracts and about 3 times our normal submissions for side events, for workshop proposals. So we had a lot of very hard decisions to make. Each presentation poster that you'll see here this week was selected through a double-blind, peer-reviewed process and has been curated to provide you with the best science and evidence from across our sector and from across the world. And so I really want to give a special thanks to all of you that participated as reviewers. You are the real unsung heroes of our conference, and we really appreciate that. I can see several of you in the audience. Very grateful for the work that you did to help us ensure that we could bring the best science forward for all of you. I also want to encourage everybody whose abstract wasn't selected, I'm sorry, but I'm going to encourage you to apply again next year. The fact that we get 700 abstracts means the quality of this conference gets elevated, right? You guys are really driving us to success, and you're driving us to better stuff for all of you, and we really appreciate that. You're making us better by doing it, so don't be dismayed. Please do submit again for next year, and you too can be part of this process of making us better. A special thanks as well to all of you who worked with us to develop the plenary sessions throughout the week, and of course to our sponsors. Hang on a second before we put the sponsor slide up. I want to give a special thanks to Clarissa. I can't see her. I know she's here somewhere. Clarissa, thank you. Oh, all the way in the back row. That way she can make jokes about me while she sits back there. But thank you, Clarissa, for all that you did on chairing the plenary working group. We really appreciate that, and of course all the committee members who've helped develop the plenary events that you'll see throughout the week. Can we put the sponsor slide up for a quick second, Bart? Thank you. You know, we say this a lot, right? We couldn't do this without them. You see their names here, and we are just so grateful for the support that we get for all of the sponsors that support this conference. You guys really do make this possible. Again, all the funding that we raise for this conference goes to the conference. It goes to support our attendees. It goes to support travel scholarships for folks coming from low and middle income countries. It goes to students. It goes to many others. And so we really appreciate that support. And I do want to give a quick shout out, of course, to the Osprey Foundation, the Conrad N. Hilton Foundation, RTI International. We really thank all the support from all of our partners, but they really stepped up this year, and that we're very grateful for that. Okay, next slide, Bart, so we can move away from that. All right, a quick show of hands. How many are new to water and health this year? Okay, look at that, a good portion. That's great to see. And look, I just want to give a special welcome to all of you guys who've come here for the first time. You know, this is something we're really excited about. We want to get that new blood into our conference. You know, this conference is hosted by the Water Institute at UNC. The goal of the Water Institute is to promote water security through research, policy, and practice. Our tagline is that we want to improve the way the world works on water. And in practice, the way we often look at this is through 4 steps. You know, our first step is, can we identify a problem that matters? And that matters part is key, right? You want to find a problem that really can make a difference if you can solve it. 2, can you develop a solution? 3, can you then test that solution in the environment in which that problem exists, right? Not just randomly in a lab, but in the actual environment where those problems exist. And then 4, assuming we've got a problem that matters and we've got a solution that works within the context that those problems exist, how can we then use that science and evidence to drive global change in the application of those solutions at scale? And that's what we really are after. In other words, we want to translate that science and evidence into action through policy and practice. And that's the goal of the Water and Health Conference. You know, our goal here is to integrate the evidence, to integrate science and evidence into the work that we do, to catalyze greater, more effective, and more efficient action at scale, you know, so that we can deliver greater results for the people we serve, especially the most marginalized, right? That's what we're after at the end of the day. And again, we take great pride in the fact that the science and evidence that you'll see here went through that double-blind, peer-reviewed process, right? We are really trying hard to bring you the best science and experience that we have. Not just science, but experience from the lab and the field. Because, you know, for us, experience really matters. And we mean experience of all kinds. No matter who you are, how you're connected to water and health, your experiences are important to informing the way we all work. And so whether that's indigenous knowledge, the experience of workers, the lived experience of those without access to wash services, these are all part of our trying to understand the behaviors, the prejudices, the systemic inequalities that impede service delivery and equality of access. And so sharing these kinds of learnings and experiences across those divides, of race, culture, history, wealth, meritocracy, opportunity. I'm sure I missed some. This is what makes this meeting unique. We've all checked our fancy titles at the door. We're all equals in this conference, and we're all learning from each other. And that's what a key part of our success here. And that's why we're really excited, especially for all the new people who've come to join us. We really appreciate that. So thank you again for making that journey and bringing your knowledge and experiences to all of us this week. And don't be shy about engaging. That's what this is for. We've specifically designed this event so that you can feel comfortable asking questions, interrogating the scientists, having those debates. This is your opportunity to engage and make us better. I'm going to read the UNC's land acknowledgement statement in a minute. Those of you, we got a lot of new people, so for those who've been here before, you've heard this before, but for those who are new, I'm not a big fan of land acknowledgement statements. I have a lot of concerns with them, and so do a lot of the communities that are reflected in those statements when I talk to them about these types of statements. They tend to whitewash our past, and they fall short of committing ourselves to thoughtfully redressing the crimes and issues that we talk about. And so in my view, I think these are real shortcomings of a lot of these land acknowledgement statements. Today is Indigenous Peoples Day in the United States. In many places throughout the U.S., this has replaced what we used to call Columbus Day. And Indigenous Peoples Day is not a day of celebration. Rather, it's a time that's been set aside to reflect and recognize the contributions that Indigenous people have made to the history of the United States and to mourn those that have been lost to genocide and Western colonization. It's also an opportunity to kind of reflect, I think, on some of the core values that are strongly held within these cultures and communities and their potential value today, some of the things that I think we've walked away from. You know, for example, respect for nature, that we all share this deep connection to land, water, animals, and to living things, community and shared responsibility, the value of mutual support and cooperation, and gratitude and humility, acknowledging that the gifts of the natural world and the contributions of others are truly gifts to us. And these are themes that I think we also want to carry through our week while you're here. And so the acknowledgement statements that we have, in my view, shouldn't really be this perfunctory reading of words, but really a jumping off point for discussions and reflection. Acknowledging values that we may have lost and may benefit from embracing again. And acknowledging that many of the privileges we enjoy today were built off the lands of Indigenous people we've displaced and the blood and sweat of the enslaved population here in the United States and elsewhere. I certainly personally, as those of you who've attended this conference for a number of years, have been going through this personal journey, so to speak. Each year I spend time reading these land acknowledgement statements, doing more of my own homework. I didn't realize that at the time we had a very strong enslaved population here in the United States, that the GDP of the slaves was 10 times the rest of that of the United States. They were the backbone of our economic growth. Everything I've enjoyed here in the United States has been because of that population. These are things that we don't talk about very often, something we should be talking about as we do our own work. After all, that is what all of our work is about, and it's what all of you are doing every single day, and I know that, and that's what makes it such a huge pleasure to be able to stand up here and talk to all of you, because I know this is a commitment that you all hold close to. So with that in mind, we do want to acknowledge that North Carolina is home to the Occaneechi, Lumbee, Coharie, Halawasapani, the Eastern Band of the Cherokee, Meherrin, which, by the way, is an Iroquois nation, and their name actually means people of water. That's what the Meherrin means. It's something we all hope to call ourselves someday. The Tuscarora, Sapani, the Wickamassuan nations, along with many other indigenous peoples living in both tribal, homeland, and urban settings. In fact, North Carolina has the largest indigenous population east of the Mississippi. We acknowledge and give thanks to the first peoples of this land and their descendants. It is also important to acknowledge and honor the crucial role of enslaved people in the early days of this campus, where we all sit today. Enslaved people were sold as escheated property to help fund the establishment of UNC, and the labor of enslaved people built UNC Chapel Hill and undergirded its operations until emancipation. We acknowledge and give thanks to the enslaved people who built UNC and their descendants. let's go a step further. May we build upon these memories and that goodwill for all who've walked here and labored before us in truth, integrity, and honor, and may we all commit in our own way to serve and restore dignity, land, and opportunity to those who have been oppressed. And again, I know you all are committed to that ideal. All right. We have a very exciting week coming up. Many of you have already participated in side events this morning. I had a great pleasure of being in a side event looking at household water treatment this morning. I'm really excited about these things. In a few minutes, we'll have an opening plenary on the future of WASH. Kata will provide some highlights of the opening week at the end of today's plenary, but I did want to let you know a little bit about the plenaries for this week. Tuesday's plenary will explore the impacts of evidence-based guidelines on good practices on the ground. I think many of us have been involved in generating these large documents that hopefully provide tools and resources to people in different situations across the globe to help improve their. Do they actually work? You know, how are they internalized? Does anybody actually read those documents? What do they mean? How do we make that process more effective? That's what Tuesday is going to focus on. On Wednesday, we'll be talking about money. Recent studies by the World Bank have shown that large portions of national budgets committed to WASH go unused, and that current use of resources is hugely inefficient. So what really needs to be done to break down the barriers and to mobilize the funding that we need to provide sustainable WASH services? On Thursday, we'll be discussing climate resilient WASH. What does that really mean? And how do we make how do we make WASH services more climate resilient? And can the WASH sector contribute to global mitigation efforts? Friday's a special day. We're actually doing something a little bit different than we've done in past conferences. The day is focused on achieving the last mile in high-income countries. Within the United States, some of you may not be familiar, but there's still areas, even here in the United States, that practice open defecation. In some states, like North Carolina, nearly 30% of the population relies on well water and on-site sewerage, all of which is unregulated and often unmanaged. So what do we need to do to reach the underserved in these higher income countries? It's still a remaining challenge and one that we're turning some attention to. We'll have two special guests joining us. In the morning, we'll be doing a fireside chat with Michael Reagan, the administrator of the U.S. Environmental Protection Agency. The mission of the EPA is to protect health and environment and ensure that Americans have clean air, land, and water. It's your chance to hear more about how the agency's efforts to reach the underserved are working and what can be done to prepare for emerging water challenges such as lead, PFAS, some of the higher order issues that some of us talk about. The afternoon, we'll be doing another fireside chat with one of my favorite people, Elizabeth Beiser. She's the former secretary of the Department of Environmental Quality here in North Carolina. You may ask, what does that person know about water? Elizabeth has spent over $6.5 billion in her last 3 years to address water challenges within this state, mostly focused on trying to reach the underserved. She's worked directly with communities, utilities, and regulators to bridge these gaps. And I promise you, if you stick around, you won't be disappointed. And so do stick around to Friday. I think that's going to be an exciting day. I also want to call a little bit of attention to our daily tech showcases. They will happen right after our plenary events. You'll go out, grab your lunches, and go into the express line for those of you who are going to the tech showcase. Everybody else, please be patient with them. Grab your lunches, come back in here, and you'll be doing the tech showcases where we're going to be looking at innovative technologies for improving WASH services. And we also have a new Spotlight series where we're seeking to bring attention to new issues and critical ideas or countries particularly struggling with some of these challenges. And so throughout the week, we'll have a special spotlight going on each and every day. So as you approach the week, though, really don't forget, again, why you're here. It really is to interrogate the science, to learn from each other so that we can all do better. So don't be shy. All your voices matter, and you're all welcome. Okay, I'm done with my any opening remarks. Just a final thank you to everybody who's online, a final thank you to all of our sponsors, and a final thank you to all of you for, again, coming here and making this happen. We'll now turn to our opening plenary. Our opening plenary is titled The Future of WASH. And a lot has happened this past year that should inform our own thinking about what we should be doing where. We have a UN water strategy, we have recommendations from the Lancet Commission on Water and Sanitation, Hygiene and Health, the reemergence of system approaches, climate resilient wash, and lots of things are going on, right? So this is our opportunity to explore that, what we've learned this past year, and how should it inform our thinking about our future direction in WASH. And we've assembled a great panel to reflect on what we've learned in this past year and what this finding means for the work that we do. So I'd like to invite our panelists up to the stage. So if you guys could step on up, Bruce Gordon, who many of you know is the unit head of water, sanitation, hygiene, and health at the World Health Organization. You can come to that side, it's probably easier. Robert Kukubia, he's the CEO of Water Services Regulatory Board in Kenya. Claire Chase, senior economist at the World Bank. Amy Pickering, research associate, Stanford Woods Institute for the Environment. Dr. Mary Ashinyo, deputy director and institutional care division quality lead in the Ghana Health Service. And Professor Katrina Charles, professor of environmental health risks, University of Oxford. For those of you again who are somewhat new to these events, we do have microphones positioned at the two sides. And so as we engage in our conversation, I'm going to step off the stage and I'm going to wander on down there because I like to look at them rather than to look at you guys when we're talking. So I'll wander around, but if you guys have questions that you want to ask the panel, go ahead and stand up behind one of the mics, and then I'll be able to recognize you as you go up. We'll also be checking online for those of you who are online, and I believe there's is that the Q&A function or the chat function that they should be using to ask questions online? Do we know? They can use the chat function to go ahead and ask any questions online. So go ahead and feel free to do that. And I'm going to start, Bruce, with you as I head on down the stairs, hopefully not tripping and falling on my face, is to talk, the UN 2030 water strategy, a little bit about what prompted that. What need was it trying to fill? What are some of the key challenges that you guys saw as you went through that process? And what do you see as some of the new novel innovations that are coming through in that strategy that we should all be taking away from it?
Okay, well, thanks very much, Aaron. And be careful walking down the stairs. Yeah, I mean, I remember sitting actually here, and there was engaging with an audience about just prior to the UN conference 2023, and there was a number of questions on, what was going to come out of that, and we had a general assembly that actually called for this strategy. We actually haven't had a strategy before, which is an amazing thing to think. 36 UN agencies all working on some aspect of water, not coordinating as well as they might. And I think that is the strength of the strategy, and that's what one of the, I think the big things, Aaron, here is that we need to, there's a desire to mainstream water into all these other sectors because water sits kind of everywhere. And if you think about the agencies represented, you think food and agriculture, you think environment, development, there's many agencies working on aspects of economics, climate change, all these things. So what is it that they can interface on together that can be better, and how can they support countries better? When I think about health, because my role with WHO is interfacing with all these elements of health, is very complex. If we take one agenda alone, antimicrobial resistance, there's a big political declaration at the UNGA, and that had elements of WASH in healthcare facilities, looking at reducing waste from pharmaceutical manufacturing, reducing WASH in communities and households. So ultimately, when you think about that agenda, there is so many health actors involved in that, right? IPC, infection prevention, all these neglected tropical diseases. So every single sector has that complexity, right? So the key is how to work together better. The other thing is, and you may remember this from your role in the State Department, is just where is this on the political agenda, which isn't an easy question to answer. But if we think to the future, we've got a new UN Special Envoy on water, so that will help with interfacing with governments. We have a next conference, 2026, on water, again at the UAE, co-hosted with Senegal. That should give us some extra impetus. And we've seen, just this morning, looking at my email, there will be the heads of state from the G20 talking about the importance of water and sanitation. There's a One Water Summit. There's even a new organization being proposed by a new entry into the field of water and sanitation in the Kingdom of Saudi Arabia. So that there may be even intergovernmental processes at work. So I mean, I guess the question is this unprecedented political will? And these are lofty goals, and with the strategy we're trying to promote this obviously and try to get some alignment. But the question is, can we translate this into impact and assistance for everyone here? Will there be more financing? Because I think at the end of the day, there's this sort of glass is half empty story with, okay, we've got all these processes in place that can help us, but then we have a financial crisis. And so a lot of attention now being on using money more efficiently. So I think that when we think about the strategy, yes, the multi-sectoral, multidisciplinary, getting non-WASH or actors on board, the financing, the political will, those kind of things are all going to be sort of looked at. And I know it's a little bit up in the air in terms of mystique and what does the UN do, but we've had heads of UN agencies all sort of sign on to this. And so I think I rest very optimistic that this is giving us the tools, if we use them well, to foster better work, especially to support countries in terms of technical assistance. You talked about guidelines, but there's lots of technical assistance we all give, and we need to do that in an aligned and an efficient way. So I know it's not necessarily exciting to talk about alignment and efficiency and working together and coordination, but frankly, that's what we need to do. We're all moving away from this project approach. We know some of these smaller timescale and scoped interventions on WASH aren't working as well as they should. We know we need to move to WASH systems. So it's a complex agenda, and that's where we're heading, and we should embrace it, but we need to spend that extra time coordinating together.
Well, so Bruce, what would you suggest that for the people here, what would we do differently now based on what you learned through that process?
Well, I think one of the things that we're doing now is we're doing these things called priority collaborative actions, and we have various entry points. One is about learning. It's learning and accounting. And I feel like the research community, I know there's research and policymakers here as well, but I think we need to do more to share that research, to coordinate on that research, and to bring that research as per tomorrow's plenary into action in a way that is involving the people that use the research. So I think as far as the Water and Health Conference and just everyone here today, like it's there is a need for this. I look at the research, and I guess we'll hear more about research, but yeah, there's a lot of opportunities, I think, now to do really interesting research with maybe not as much evidence as we would like, to help policy making and interventions succeed when they haven't before.
Well, were there any key questions identified that you want the research community to look at, or is this just a general call that we need to improve our science and evidence base?
I mean, on the one hand, it's a general call, and then in the other hand, if you zoom in and look at any agenda, and I mentioned AMR, like there's even on AMR alone, there's a number of WASH questions about how to, operationalize and improve WASH in healthcare facilities. What is the potential health impacts of AMR in terms of, emergence and spread of infections from wastewater and sanitation, for instance. So all these, we can just dive in. So there's a lot of how-to questions, how to do things, and there's a lot of like, well, actually, if we do things better on WASH, there's a lot of benefits, and we haven't really been able to communicate those and quantify those. Even on WASH-burdened disease, we have a figure, it's about 1.4 million deaths every year. But we know that's a gross underestimate because we're not able to quantify things beyond diarrhea and acute respiratory infections and a few others. So I think even for the advocacy voice, that was just picking up on a few. We could do, I think, a lot better, both on the how-to and on the evidence to advocate.
Okay, we're going to come back to this because to be frank, I'm still not sure I heard from you what this strategy is going to change. I mean, I appreciate the fact that it might build better coherence among UN agencies and other entities. I'm not sure I hear the priorities coming out of it yet, but I'll give you a chance to think about that for a second. Because you did mention that, because let's find what the science and evidence is telling us about. And we had the Lancet Commission recently sit down and produce a report as well about the future of WASH and some of the challenges they saw. Amy, what did the Lancet Commission come up and suggest are some of the key gaps, either evidence gaps that we need to fill or directions where we think we've got enough evidence that we should be really now investing in?
So I think I'm going to start out with a quote from the Talking Heads song Once in a Lifetime, because I think it really embodies the spirit or the sentiment that a lot of people were feeling when the Lancet Commission was born. Here's a quote. "You may ask yourself, well, how did I get here? Am I right or am I wrong?" And who knows that song? It's about having an existential crisis. And so I think that's what a lot of us were feeling when we started working on the Lancet Commission. And we now have about 100 pages of text, and I'll try to summarize all of that in 3 words for you all today. It's quite simple, actually. So here are the 3 words. They all start with R, so you can remember them. First one, reflection. Taking a critical look at how we got here today in the WASH sector. What's the history of the WASH sector? What mistakes have we made? And how can we learn from those mistakes? It's easy to just sweep them under the rug, but that's not how we can do better. Second R, responsibility. I think we spent too long putting the responsibility on those that are least able to bear it. We need to move away from do-it-yourself WASH and move towards system strengthening and putting the responsibility with governments, but also having everyone support governments in being able to deliver high quality services. Third word, resources. And what do I mean by that? Financing. And WASH is not cheap, it's expensive. And we have to dedicate serious funding to move towards professionalized high quality services. And it's about laying down infrastructure, but it's also about service delivery models. Yeah, and so, I better channel Barbara just for a second for one more word that doesn't start with an R, but it's professionalism. So if you can take one word away, it's professionalized WASH services.
Well, Amy, maybe you can go a little bit deeper, because we've got the WASH benefits, we've had MAPSAN, we've had a lot of these other trials going on, which produced evidence that's left us a little bit concerned, and in some cases we're not sure how to interpret, to be frank. And it's been a little bit of time since some of those studies. Has our views on what those studies mean to us as a sector changed? Has the Lancet Group reflected on some of that and said, look, these investments still matter, here's how you have to contextualize it?
Yeah, I mean, that was definitely a part of the motivation for the Lancet Commission, was the disappointing results from WASH benefits and SHINE. We weren't able to move the needle on child growth and stunting. We are seeing, some positive things trickle out of those studies in terms of, when uptake was high, we did see health improvements, reductions in specific pathogens, reductions in diarrhea. But what I hope is that these studies really spur us into action and make us understand that household level basic interventions are not going to provide the types of health benefits that we know WASH services can provide if they're delivered well at the community level and in a professionalized manner. And so, I feel a little bit like a broken record, but we've got to move away from do-it-yourself WASH, and we have to put in the hard work to work with governments to do the system strengthening and the work that needs to be done to build strong institutions and service delivery models.
Sorry, what do you mean by do-it-yourself WASH?
So that's what a lot of these household level products do. They put the burden on households, behavior change, to treat their water every day, try to use difficult to use hand washing stations, and that's really putting the burden on households, and it's really putting the burden on mothers, and so there's a huge gender burden associated with that. And for all this time, we've said, oh well, we need low-cost interventions to be able to scale. But it turns out that those are not low-cost interventions. They're high cost. And there's a lot of hidden costs associated with that that falls on the people that are least able to bear it.
Well, I personally still believe a lot of those interventions play an important role in laying the groundwork for other solutions and as an evolutionary pathway towards more sustainable services and creating that demand. I don't know, Katrina, you've had a lot of experience with some of these things on the ground as well too. How does, with a couple of issues here that I do want to follow up and tease apart on, I do want to get to the resource issues and the financing. I also want to better understand systems, and when you're talking about systems, what that really means. But I am wondering about this idea that these household type interventions may not be the right ones. But I don't know, Katrina?
I would absolutely support that the household ones aren't the right ones for reaching water safety in particular. And so that's the area where I'm most focused. And what we see is that for people to manage water safety, they need to be able to understand it, understand why they're making decisions for things. So they need data on what those contaminants might be and their self-efficacy as to how they can intervene with that. So that's a really complex system to deliver. If we're trying to deliver that capacity building in every household and that education at every household level, we can be more effective if we can target that at, say, professionalized service providers. As you say, we have people whose job it is, who have incentives to do this well, to apply their training and provide that. We see in households where we work, understanding some of these intra-household issues, these extended issues in households, that they, in some of the poorest communities, they are doing work to improve the water quality, and they're focusing that effort on the things where they can see and taste differences. So it's about removing the particulates. It's about getting away from saline sources, getting nicer tasting water. They're not prioritizing boiling. They're not prioritizing those issues because they're not seeing the hazards there.
I'll just say I know that wasn't the case for my in-laws, and we had household disinfection in the household all the time, and that's the way my wife grew up, so I'm going to counter that a little bit. But I hear you, right? The idea that we have to head towards professional services, professionalized service delivery, that's the way we achieve safely managed services, and I think that's an important part of what we're talking about. Sorry, Bruce, is that more aligned? Is that akin? Is there a statement in the strategy that says that's where we need to head?
Well, I mean, when you think about, it's quite, you asked about how did the strategy sort of come about and what was the analytics in terms of picking up priorities, and it was really this global acceleration framework where there's 5 accelerators. One is governance, and a part of governance that could be the key piece here is the strength of the regulatory institution, right? And then you've got, that is supporting professionalized service delivery, because you need to start investing in the structures around what enables professionalized service delivery. So, sort of no more volunteers, people need to get paid, you need to recover costs from the service provider at some point to actually get that good service. So that ends up being quite complex. So we all talk about systems because of that. That's a big part of it. I mean, obviously the UN strategy WASH is one small piece of or I would say, actually I shouldn't say small, but it's a good piece of a broader strategy where we start thinking about water resource management and all the linkages and climate and all that stuff. But yes, I think that's a really key point here. That's where we're all going. We're all going to agree on that. Maybe there'll be some, I don't know, differences on how we get there. There's a lot of fuzziness, I think, because I know you sort of were saying, well, I don't know if you're a fan of, but there's some utility in doing some of these precise interventions that, everyone gets their head around. You can explain a water filter and disinfection to everyone. But obviously there's been a lot of challenges, right, with sustainability and impact on that. And so I think the question that I often get asked by, for example, the cholera community is, okay, well, should we have point of use water treatment? Should we, all this short-term stuff? And we're like, well, you need to think about some of the longer-term kind of institutional reform, they don't like that. They want to identify medium-term WASH, whatever medium-term WASH is, and it might be the sort of risk assessment, risk management, water safety planning, sanitation safety planning, where we go a step further in terms of diagnosing the problem.
So then this is an open question. When you talk about system strengthening, you're not talking about just water itself. These underlying systems actually relate to lots of different services that are being provided by communities and support lots of different services. So what does system strengthening really mean to you guys in terms of the water sector? Who specifically are we talking about? Which systems are we talking about strengthening? I don't know, Mary, I know you are very involved around the health sector and delivering services in Washington healthcare facilities, and these system discussions come up quite a bit in that sector. I don't know if you want to reflect on that.
Okay, thank you so much. When I was looking at the UN strategy, there were two things that I wanted to talk about. I looked at the UN strategy identified entry points, which I think is very important when we talk about health system strengthening, which will then make sure health systems are functional and then will then make sure health systems become resilient. And I looked at entry point number 2 and 3. It talks about stakeholder engagement and partnerships and integration into government processes. And that got me thinking that we have a lot of opportunities. When you look at the agenda item for the World Health Assembly, there were about 66 agenda items. And if you looked at all of them, almost all of them, WASH was very critical. Right from health for all, primary health care, WASH is one of the critical elements. If you talk about universal health coverage, we are talking about access to high quality services without financial catastrophe. And WASH is fundamental to quality service delivery. If you then come to current trends, we are talking about pandemics, global health security. WASH is critical to controlling and preventing pandemics outbreaks. And whether it's maternal and child health, nutrition, everywhere there's WASH. WASH is critical. So I think that is a very important opportunity for health system strengthening. Before we can get health systems to be resilient, we don't build resilience during stress moments, like during outbreaks. We build resilience before, when there are no outbreaks. Then the systems become functional, and then when there's an outbreak, they can stand the stress, perform, deliver health outcomes, and then beyond the outbreak, be able to bounce back. So that is, for me, that is what it means for me when you talk about health systems strengthening. I think it's a change from health systems strengthening to health systems functioning, and then health systems resilient. So health systems strengthening also means that we need to intentionally invest in all the building blocks through all the programs that we have identified, and make sure that these systems are also synergistic. I remember one incident, usually when we have to do the glass M&E for AMR, for example, the AMR Secretariat will say, WASH IPC program, give us your achievements for the year. And then when we have to do for maternal and child health, it's the same. So we don't do WASH for AMR separately and do WASH for maternal and child health separately and do WASH for programs separately. It's WASH for the health system. And that is linked to all other programs. So I think that we have a good opportunity there, partnering with different stakeholders. WASH is very multidisciplinary. For example, if I want to have water in healthcare facilities, what I will do as a government actor, because government doesn't have money for WASH. That's the reality. I mean, you don't get it. Most of the interventions that we do for WASH is funded by our DPs. So government will say, okay, this is our plan for the year. Then I would now have to call WHO or UNICEF or the World Bank and say, do you have funding for piping water into these healthcare facilities? And they will say, yes, we have funding. Then I'll call Ghana Water Company because they have the engineers who pipe water into the healthcare facilities. So I think if we really want to get the results that we want to get, then we need to really map out the stakeholders and the roles that they play and bringing them together to the conversation and letting them know what we expect of them. Previously, the engineers didn't realize that we were really expecting a lot of support from them. But when we started engaging them and they realized that, well, they are part of the health system, they come on board and they are very excited to contribute when need be. So for me, that is health system strengthening, making sure that all the programs that need wash, all the systems that need wash, we are investing in all the building blocks and making sure that the systems are functional ahead of stresses, so that when there's a stress like an outbreak, the systems can continue to provide service delivery and then be able to bounce back after the outbreaks are over. So those will be my initial submissions for health system strengthening.
So no, I really appreciate your point about the resilience of systems and building that at times when they're not under stress. What are the metrics or are there metrics and indicators that could be, I worry about donors investing money in these types of things. And I suspect it's challenging for donors when we don't have clearly defined metrics for building system resilience, so to speak. Do you have metrics for that, or is this an area that needs to be grown and developed?
So we have metrics for that, and that would depend on the program that what we are measuring, what would be the objective of the measurement. There's let me also try to get a quote. There's a quote that says that the world cannot be defined without numbers, but we can't define the world with only numbers. So a lot of the things that will make us make further strides are not in the metrics. They are the things that, I like the Aragon framework, which talks about tangibles and non-tangibles and softwares. Most of them are not things that we measure. So for example, when we are doing partnerships, World Bank wouldn't have an indicator like proportion of stakeholders who say that they trust each other, for example, when it comes to funding. But that is something that we need to be self-aware about. The other things that we don't measure. That has helped us a lot in our partnership, knowing what people's interests are. If I'm getting money from WHO, UNICEF, World Bank, USAID, and the DPs that we work with, I know one of their interests is to be visible. So I have to make sure that their visibility is achieved, and they want to show to their donors that they are making impact. We have to make sure that is achieved, which is not a bad thing, because that is how they will get the funding again and come back to fund us. So I think it's important for us to keep an eye on the metrics, but also the things that are not in the metrics, because that really is what gets stakeholders very interested in the work and being able to support the WASH implementation for us to get results. Yeah. Yeah,
so the World Bank is, if I'm correct, right, they're still the world's largest investor in water and sanitation services globally. And now you are part of the UN system, so you still have a connection, so to speak, to this strategy. But I know that the World Bank has been working for years to try to work at this integration type of a challenge. What parts of this are you taking away in terms of new directions for the bank and the investments it's trying to make over the near-term future? And what are some of the impediments you see to that?
Thanks, Aaron. And let me just start by saying it's an honor to be up here. I've been part of this conference, not as long as some of you, but really happy to be here. And also kudos to under your leadership for really growing this conference. I think that's a real testament to your leadership. So the World Bank is a UN Water member. We have been supporting the development of the water strategy, but I think the World Bank has a different governing structure. We report to a different board, so it is a bit of a tricky subject for us to formally endorse the UN water strategy. That is not to say that our institution does not think that this strategy is in the right direction. And Aaron, I think you were a bit hard on Bruce earlier.
Sorry, Bruce.
I mean, what are we expecting the UN Water Strategy to do? I don't think the role of the strategy is to identify the research questions. I think the people here, the academics, the policy implementation, all of us together define those research questions. But the UN Water is a coordinating mechanism. And I think that's really the value of the strategy. And I think also the fact that, surprisingly, already 10 years, almost 10 years into the SDG period, we finally have a common definition or sort of structure framing for the water sector. It's not just SDGs 6.1 and 6.2. And I think that's important for convincing governments to invest in the water sector, for advocacy purposes. We know that achieving SDG 6.1, safely managed drinking water, it's not possible if we're not going to be looking at water resources and efficiency of water use. So all of this, and that's the other system that, I think we're not talking about, but there is also that water system, the full water resources cycle that needs to be taken into consideration. So I think that has been very important and a very important role of the strategy. And I would encourage everyone to read it because I think it does help to articulate what what SDG 6 is all about. Again, I don't know why it took 10 years, but then it happened in 6 months. So, so I think for the World Bank, I think a couple important gaps that the UN Water Strategy helps to fill. One is through this collaborative implementation plan. By identifying what all the agencies are doing helps to also understand what are the gaps, because, and it's not just the UN, we know it's not just the UN agencies, it's all the governments and all of you that are doing things on the ground. But for the World Bank, we do often use UN agencies when we're working in fragile settings. And before my current job, I was working in South Sudan on flood risk management. And in that situation, we needed to have a UN agency to support the government for implementation. And it was very difficult to find the right partner who has that capacity for flood risk management. So I think that by articulating this collaborative implementation plan and sort of identifying what are the actions that the different agencies can take on will help us to identify where are the gaps and where we need to plug those gaps. And then I think the second value proposition of the strategy is really to help with country coordination, to raise the financing that's going to be needed to deliver on SDG 6 and beyond. For the World Bank, it's fantastic for us to be able to say, okay, this is what the other UN agencies are doing, having that understanding at the country level of what's happening and where we can complement one another, and then some sort of multi-stakeholder partnership. I know that there's the SWA, but how do we really make that work on the ground at the country level systematically to bring in the right partners and raise the financing?
Well, and our water people, the right people to do that kind of work. This sounds a little bit different. I mean, you're talking about really very complex systems of systems. You've got multiple systems going on at the same time. You've got health systems, you've got financial systems, and we'll come to that in a second because I want to hear a little bit more about that. Hydrometeorological systems, because we're going to talk about climate in a second as well. Yeah, all these things are overlapping each other, and how you bring that expertise together in a meaningful way becomes a real challenge around these types of a project on the ground, and to make it work. The bank is a key financer, and so maybe I'd love to hear from you and Robert a little bit about, we've talked, finance came up a couple of times. Financial systems are completely different in the way they operate and why they loan and why they don't loan. What are the things that we need to do to help mobilize additional financing into our sector? We talk about this a lot. I'm not sure we've made any real progress, but what are the things that have happened in the last year that make you think that there are some entry points and opportunities? And
Maybe I can start and then hand it over. So I think you'll hear more about this on Wednesday. But I will say that, so the World Bank did release a report in May of this year, Funding a Water Secure Future. And I think that report does paint a bit of a different picture from what we have understood. So of course everybody hears we need $1 trillion annually to achieve the SDGs, and where's that money going to come from? And what that report shows is that there's a lot of funding in the system already that's being used inefficiently. So if we just take some of that, which is, again, it's working on the systems and the institutions and the regulation and all of those aspects that need to be there for a well-functioning financial and delivery system. But if we can capture those resources that are being used inefficiently, so I think the statistic is something like 28% of budget allocation to the water sector on average goes unspent. And that compares with 17% in energy and 9% in transport. So we're just, I mean, on the one hand, we're not doing a good job of using the resources that we are given. And on the other hand, yes, there needs to be more financing. I think it's only 1.2%, I think, of, on average, government allocation to water sector, compared with, well, I have the number here somewhere, but I don't remember the exact number, but I think it's 4% to energy and transport. So it sounds like a little, not that much more, but it's actually massively more, and the fact that they're able to use that allocation. And then, of course, the private allocation, the private sector contribution. So over 90% of these allocations are coming from public sector, less than 2% from the private sector. And there's a whole host of reasons why that is. And I think that, the World Bank and many other partners are working on trying to tackle those bottlenecks to private sector financing, doing things differently from what has been done in the past. And I do see, I'm optimistic about the possibilities there, which we can get into more, but let me hand it over to Robert.
Yeah, Robert, I'm curious.
Well, thank you very much. I must say it's also an honor to be in this panel and this conference. But coming down to the issues we are raising here, finance is a very attractive issue to talk about, especially when you talk about the huge numbers involved. Because in the political levels where we talked about, it's very attractive for them because they only think about finance in terms of infrastructure. Now, system strengthening is supposed to divert the focus on infrastructure. But I'm not sure whether our policymakers understand that, because all the time in these very high-level discussions, and I'm very happy that they participate in these World Bank meetings, UN, and all that, what we ask ourselves down there when we go home as professionals is whether really the mindset has changed. But from my experience in terms of what I've been doing, I've been in regulation and policy for half of my working life. And you can imagine how long is that, because I'm now retired. I used to ask myself, even us as professionals, are we really converted? Because we talk a lot about political will, but I also ask, is there any professional will? Because a lot of the mess that is happening, as much as we may want to blame our policy makers, it is actually from us as professionals. Why? Because we are not spending the money we have. We just spend quite a bit of time asking for more. And even what we spend, there is no value for money. So a lot of this should also be focusing on us. So for me, whether you call it system strengthening, enabling environment, governance, whatever, it still forces it. Talk about that, that's fine. But don't forget that you still have to go back to the basics. And the basics are really what now you start asking why it is not happening the way we would want it. And that is why systems now talk about finance, you talk about regulation, you talk about policy level work, you talk about even our own cooperation, our partnerships. Are they really committed to the cause? Because if they were, then we should actually be doing maybe thinks differently. And I know Bruce has been on the spot. I also want to put him on the spot. I really like about UN agencies, and they talk about UN water and all these things. But my experience in this work, when I was working, I'm not talking about now when I'm a consultant, is that we are a bit opportunistic. We are not systematic. When you come down to our countries for these kind of interventions, you have to go, it has to be country specific. Where is the country? What kind of decisions have they made at policy level? Are they having any problems implementing these decisions? You cannot be arguing about how good or the quality of that decision. The fact is the country has made a decision. Are you going to support them to implement that decision? Or are you going to be part of the discussions about, oh, we should have done this the other way? And that takes forever. So for me, help me to implement my decision. Let me discover the wrongness or rightness in it. And then I'll be learning. But you don't help me by telling me, you know, you should have done this the other way around. No, I have already made a decision. It is in policy. I've decided that there will be regulation. There will be regulation for the water services sector. Can you help me implement regulation? And I know that implementation of the regulation is not going to be easy. It's not a walk in the park, and I understand that. The other point is that as much as you are giving us a lot of this support, you cannot solve the governance crisis within our sectors. The governance crisis is for us to sort out. Why? Because the governance crisis is not, in as much as I believe in actually evidence-based, science, whatever, the governance crisis is not about science. And even when it comes to science, the politicians have other things to look at, not just science. So there are some political necessities that may be very important for us to consider within our context. And this is country context. So the money is there, yes. I know it's a lot. I know, and we'll be talking more about this, I think, tomorrow or Wednesday, I think.
Yep.
But at the end of the day, it is up to us to actually see where we are spending the money wrongly and correct ourselves. You cannot really be opportunistic in terms of telling us, because of this is the line that you have to tick a box at the end, we have to follow this. And then at the end, I come back to my own basics and see my people still do not have water. And as we talk about this, let's forget it doesn't have a lot of meaning to somebody who does not have even basic access. So one of the priorities is that basic access, so that now we bring in and see, for this now to continue serving you, there are systems that we may need to consider. And those systems have their own microenvironments, which really we have to decide whether it is partnerships or whether it is us as governments that are going to do it. I think for me, that's the bottom line.
No, Robert, that was great. And you guys will have the chance on Wednesday, right? He's coming back on the plenary on Wednesday, so you have the chance to interrogate him more fully. And that's part of it. All these folks are going to be appearing throughout the week, and you guys get the chance to continue these conversations. This is just trying to give you a sense and a flavor for some of the things they'll be talking about. And I couldn't agree with the investment in those underlying systems and the decision-making that the governments have made are critically important to being able to implement. But a lot of those things fall outside the scope of the small programs that get funded by development partners. And that's a real challenge. I worry about climate in that regard. And I've heard a lot lately about WASH, we want to say climate resilient WASH, and climate resilient this and climate resilient that. And here's money, but we want you to spend that money on the one thing that will make now this activity climate resilient. I have some challenges with that, but I wonder if you might have thoughts on what is climate resilient WASH? How does this get integrated into our own thinking about WASH these days? And is that creating some of the same problems that Robert's talking about in terms of shifting investments in ways that are counter to what the governments need to do?
Yeah, I think the climate resilience issue is a big challenge. It's one that has, it's a really complex challenge. We've already talked about some of the very complex challenges we face. So there's many of these. By now we should know how to deal with these, I would hope, but we still have some learning to do. And I think one of the points that Robert was making very well was about that need for learning, to have a chance to try things out and to learn from that. I think that's an important thing to think about with climate resilience, because one of the things I'm involved in with Barbara Evans, who's here, and other colleagues around the world, is around setting those climate resilience indicators for WASH. So at one level, we've got indicators that, you might think about an indicator at a system level. So is this borehole climate resilient? And that's got huge issues, because there's a good chance that's going to be flooded at some point, or there's going to be a drought or something, or that everything around it's going to stop working and you end up with it being overused and falling apart. So there's a need to think about that climate resilience much more at that societal level. How do we get WASH services that ensure health at that societal level, which comes back to these systems strengthening discussions, comes back to really thinking about, if we set indicators, if we focus on what's that outcome, what's the pathway to get there, and what are the potential negative consequences of setting those indicators? Because I think it becomes really important which indicators we choose as to what incentives it sets for the sector. Because we have examples from previous years. The MDGs certainly focused us very much on infrastructure, but didn't get us to services. How do we set indicators that will help us to progress in the right way? And how do we set us up with the right boundaries for those as well? So one of the key debates around climate we always have is it climate resilience? Is it mitigation? Where does it end? But we need to be able to set these boundaries clearly to say, okay, we're just going to focus on this aspect. The other aspects are all really important, but we don't have to do everything with this one indicator and with this one approach.
Yeah, I don't know if everybody knows this, but a lot of the large development partners, I'm more familiar with the US side, we have a list of indicators and you have to choose from that list when you do a program that you have to report against, and you guys usually face the burden of reporting against them. But that also dictates then the decisions that you make and where the money flows. And so I do think getting these indicators right is critically important. But I also think it ties into some of the other things, and you mentioned, water points. I worry about, when we talk about climate resilient WASH, I worry about looking at those extra things when what we are seeing in terms of the failure of most of the systems, particularly rural systems, is usually due to the fact that these systems were not built, maintained, and operated to the proper engineering standards that we expect. And so I do worry that it might take money away from the professionalization of the sector, and something that's talked about a lot in terms of making sure that the hardware that we are building is built to the standards to make it climate resilient. I don't know if that makes sense or not.
But I think that's for us to push that funding in the right direction. I think there is the risk that we're accessing money disingenuously in the sector in terms of climate finance, of saying people are boiling their water all the time and we're magically stopping them by providing safe water. People aren't boiling their water all the time. But we do have, but I think there are other aspects to consider with that. So how do we capture that money that is for climate and put it towards these system strengthening? So for example, professional service providers, the ones we work with around the world, do amazing jobs at keeping systems running, responding to climate issues, improving climate resilience of systems and for societies. And that is recognised in the global goals for adaptation, if I can get the terms right, of thinking about what is needed to deliver climate resilient services, and professionalised services are recognised in there. And so I think finding things that we can justify investment in these areas, and I think there's a growing body of evidence here to show these are sensible investments that are delivering more climate resilient services. And yet there's evidence for that, that this can help to shift that climate funding, which is a priority for so many of the donors in the sector now, and make sure it is applied appropriately to WASH systems.
Well, and I also think we should think more broadly about what constitutes climate resilience. I don't think a lot of us don't think about system strengthening at the end of the day as building resilience and how systems can internalize and make decisions and respond to challenges. That is climate resilience. Water projects that build social coherence and bring communities together. It allows communities to access, is building climate resilience. And so I think we have to be thinking a little bit more broadly about what climate resilience, how we define that within our sector. I don't know, Amy, did you want to add to that? I thought I saw you move, so I'm just checking. Okay. I know we just have just a couple of minutes, and so I'm going to go to each of you. Sorry, Bruce.
Sorry. It's
on
interesting, though, on the climate resilient piece, because I think at the end of the day, like, we can make things very complicated, and we can have a lot of metrics that we aspire to. So we can have, gender, we can have safety, we can have resilience, we can have climate resilience. And I think, you know, it's interesting when we think to the future, we might be in danger of making that a bit too complex. I mean, a service that's climate resilient should be safely managed, right? Like, it should just be, ultimately, we need, I think, to consolidate around one metric. And I think as we, you know, move to, I mean, there's a lot of questions now where WASH will eventually sit, I think, in agencies globally, in funding. Maybe it will sit under climate, and everything will have to have that sort of climate lens, and we'll all adapt. But ultimately, I think it does come down to the things you said, Aaron, and I agree with Katrina. Like, at the end of the day, yeah, I mean, the water has to run, sanitation has to work, it has to be safe, it has to be sustainable, to all sorts of things.
Okay,
Yeah.
thank you. All right, we have just a couple minutes. We're gonna go around and let you each get any final words that you want to get in. In particular, if you think there's one thing that we can be hopeful about, or one thing that we should be pushing in terms of our new directions and get based on what we've learned over the last year and a half, we'd love to hear it. And so I will turn to, I'm not looking for any volunteer to say they're ready to go first, because I always hate calling on the first one. But Claire, it's all yours. You moved.
So final words. Well, I would say two things. One, I am very optimistic about the future. I think that, you know, as I said earlier, I joined this sector probably about 15 years ago. And I think in terms of research, we were really at a very early stage. And just seeing how the research community has grown gives me a lot of hope that there are so many questions that we need to answer in this sector, and we all need to come together to ask those hard questions and to find the evidence that's going to keep us moving forward. So I came from the health sector, which is, I mean, a whole range. I mean, this very advanced, very sophisticated research going on in health, and I think we can achieve that, and we need to be able to deliver on the SDGs. I think my other point of optimism is, you know, I think the sector has become much more diverse. You know, we have women leaders up here today. We have many women leaders in our audience. We have a new UN water envoy who's a woman. And we also have, you know, our client countries, what we call them our client countries, are governments that are, you know, we see very strong leaders, diverse set of leaders in this sector. And it wasn't always that way. So I think that is, can take us in the right direction. I think, you know, I'm very concerned, and it keeps me up at night, what we're seeing with climate, fragility around the world. And I think that those are the things that we need to move forward with our eyes wide open, because it's changing day by day, and the goalposts are constantly moving. So we really have our work cut out for us. But I think that having gone through those kind of early development stages together and getting to this point, having learned what we have and being able to learn from that, we were having this conversation before, that we do have the strength to go forward and achieve what we need to do.
Thank you, Claire.
Sorry, that was a bit
Can you
long.
pass it to Amy? We'll go down that line and then come back to Bruce. Amy?
So I think the SDGs are still really good targets. Achieving safely managed water and sanitation, that's what we should be aiming for. And I think we need to be thinking about every time we make an investment, is that on the pathway to the SDGs? Is that investment going to get a household or a community closer to those SDGs? And I'm also feeling encouraged. I'm optimistic, similar to Claire. And one reason is because this conference is the biggest it's ever been. And I've been coming here since I was a PhD student. I'm really encouraged by all the students that are coming out and showing up. I appreciate you. And you're not getting scared away. And WASH is not a glamorous field. It's not a glamorous field, but we appreciate you coming out and trying to do the hard work.
Okay, so I wanted to talk about framing and language. And I think we have a very good opportunity, especially after COVID. I remember that before the COVID response, the proportion of healthcare facilities who had basic services in any of the 4 categories was less than 40%. But after COVID, we are going towards 70% in most of the domains. So we have a lot of opportunities. Most of the terminologies that are coming up currently is just because of how the global health terrain is changing with pandemics. It's only 2 years ago that UNICEF was supporting the Ministry of Sanitation and Water Resources in Ghana to define what it means to say climate resilient wash. Otherwise, in simple English, it's easy for a child to say what is climate resilient wash, right? But so I think the framing and the definitions are very important to make sure that we are speaking the same language, because we have different stakeholders coming together. And one of the things I realized is that when WASH practitioners, in quote, try to talk to health practitioners, they use the WASH building blocks language. And then when health practitioners try to talk to WASH practitioners, they use the health systems building blocks. So these are different wordings, but at the end of the day, they're actually communicating the same message. So being able to find that connection and finding a common language, I think would really help stakeholders to prioritize WASH more. I remember the first time I made a presentation to a very high-level meeting in Ghana, where senior managers meeting, where all policymakers come together. The room was full, and I didn't understand. So when I finished, one doctor, senior colleague, came to me and said, "Oh, so this your WASH is all about toilets and water." I'm like, yes. So I think that when we break it down to people, they understand it better. And let's not assume. I think we have a lot of assumptions. We think that when you meet policymakers in very big positions, they understand what you're already talking about. But most of these appointments are political appointments. They don't necessarily understand what we are talking about. And then you leave with disappointment because you're like, oh, did he really understand what we're trying? No, he didn't. So trying to come down into English and communicating to people, I think once people understand, they are more than willing to support the cause, knowing that it's going a long way to improve the health outcomes of the systems that they lead. So framing language, making sure we are communicating and people are actually understanding what we are talking about. Thank you.
Thank you. Katrina, hope or challenges?
Yeah, so Aaron framed this session around 2050.
Right.
And before the panel, we were chatting, and I think it was Amy was saying, that's not very far away. I know for many of you in this room, that's going to seem really far away. But I do encourage you to look at some of the history of the WASH sector and see how things move in the sector. And I think one of the key things to realize is that right now, and possibly discussions that are happening at this conference, there will be decisions made that are going to really affect where we are in 2050. That there are these decisions around how we set system strength indicators, how we set climate resilience indicators, what's after the Sustainable Development Goals. Those decisions are being made now. So that's going to constrain where we are in 2050. So I think it's a real plea to think about those decisions that are being made, thinking about the long-term implications of them. But the other thing we're really lucky to have support from the UK's Foreign, Commonwealth and Development Office for a 10-year research program. And that's meant we've been able to develop research over time with government partners, with professional service providers, with Uptime, and all their partners as well, that we've been able to do research that is now leading to governments investing in supporting professional services. So the government of Bangladesh has signed up to support professional service providers providing safer and more reliable services to schools and healthcare facilities until 2030. So that's a huge shift in how things are done, which has come about because we've been able to do dedicated research, support capacity development over that long term to think about some really complex science. So if you are funding science, really think about how you can support that science to address some of these complex issues. 'Cause I think we were part of the discussion beforehand was thinking about, to think about how you measure some of this stuff. It takes 10-year research program, and not many people are funding that. How do we get more funding to help these young scientists develop to address these really challenging issues we're facing and make sure that we are in a good place in 2050 and the research we're doing now is supporting that journey?
No, that's great. And I would add to that, and don't miss opportunities to do science. There's so many projects and programs going on where we are collecting data, but that data just sits on shelves. And we've got lots of students who are ready to look at that stuff and draw conclusions from that.
And certainly I would encourage the science practitioner partnerships of working together.
Absolutely.
I think the chance for academics to work with those of you who are working in practice is so important.
Absolutely. Bruce? No mic? No.
Okay, optimism. Because I think the gloomy piece here is, WASH perceived as an intractable issue, and you throw stuff at it and it hasn't moved over years. And I think what I'm excited about is just the small progressions in the system strengthening and measuring it and giving visibility to countries, and projects that have succeeded. I feel like that's one of the big pieces here. There's more inspiration from folks that can do things maybe than science telling you about, the specific, methods and everything else. It's just like we need inspiration here. But what we shouldn't be looking to maybe is, I think a lot say we need the India example, we need some massive political change. We do, but at the same time, there are these progressions that can be made that need to be illuminated and rewarded. And whether that's, getting WASH in national action plans for AMR, getting WASH in national control plans for cholera, whether it is about getting WASH in pandemic treaties, getting people to care about WASH in different ways, and getting these institutions strengthened, and supporting countries. As Robert, I would like to be able to say, hey, look, we can, this is country-led stuff. We're going to align better behind your priorities, and we haven't done that as well as we might have in the past, and I hope that the UN system can react. I think that we're committed to do that, so that and to do that in a learning way. So yeah, there's optimism there, and I think it needs to be informed by, some of our failures in the past.
Thank you. Robert, last words.
Thank you very much. I think ultimately we have to understand and know that governments have the ultimate responsibility. So we talk about government leadership, government commitment, but we stop at that. We should go in and find out why is government leadership, government commitment weak. And for me, that weakness can be mitigated by strengthening regulatory systems. For the simple reason that within a regulatory system, the professionals converge. It is them who are now talking about what is best for the sector. You are actually bridging the gaps between engineers and finance people, finance and environmentalists and all that, because all of them seem to have their own agendas. But within a regulatory system, they are able to converge and have something and have an output that actually strengthens the government commitment and government leadership. But for us professionals, because we are equally to blame, perhaps even not more, tell the policymakers what they need to hear. Not what you think they want to hear, what they need to hear in terms of what the sector needs. And there are some brutal actions that has to come out of that from the policymaker level. Don't politicize something just because you want to be on this side or this side of the politics. If the sector needs to have a tariff that cost covers, then tell the policymaker that. Don't actually try to make it look nice. It will never be nice until we take the painful decisions. Thank you.
Yeah. I might add, maybe not for the younger professionals, because you want to keep your jobs for a little bit. So, but definitely to keep that in mind. All right, thank you for the panel. Very much appreciate it. You guys.